There's no way to sugarcoat this. The COVID-19 pandemic is getting worse. The U.S. now surpassing 40 million total cases since the outbreak of the pandemic more than a year and a half ago. Children now accounting for more than 1/4 of new weekly COVID cases nationwide. And tonight, sources telling CNN that President Biden is going to give a major speech on Thursday on his administration's plans to battle the pandemic going forward. Dr. Peter Hotez is here, the co-director of the Texas Children's Hospital Center for Vaccine Development. Thank you, sir, for joining us. So schools and universities are reopening. Stadiums were packed with fans over the weekend. Hospitals are overwhelmed and running out of ICU beds. Meanwhile, the daily COVID case average is 3 times higher than it was this time last year, and the ways to control the pandemic have become politicized. Are we going to see a spike in cases after this Labor Day weekend?
Well, we're going to certainly continue to see this firestorm progress. Now, what we're seeing now is, Don, we've had a terrible summer here in the southern United States, and more than 1,000 people have been dying daily. And now what's happening is the case numbers are starting to slowly go down in the south with a pretty long tail. But now it's moving. It's going up into West Virginia, into Ohio and Pennsylvania. It's spreading laterally into South Carolina, west where I am here in Texas. And we're seeing a second node develop now after that Sturgis rally up in the Mountain West. So I think what we're going to start to see is confluence between those two big areas. And pretty soon, except for the Northeast and maybe some parts of Michigan and Minnesota and the West Coast, I think we're going to see the numbers continue to climb. And it's going to look a little bit like England, where it went up, started going down a little bit, but then started going up again.
Yeah, I mean, you mentioned the part of the country, and you've had so many storms, and people are now in confined spaces and not able to be in their homes. And we'll see what happens after the numbers start to come out. And it doesn't help when we see our own elected members of Congress promoting anti-science messaging and targeting scientists like Dr. Fauci for fighting the COVID-19 pandemic. You called out Representative Jim Jordan for a tweet calling vaccine mandates un-American. What's most dangerous about that type of rhetoric?
Well, this is on top of several other members of Congress coming from the conservative right, consistently trying to discredit vaccines. And of course, the pinnacle of this was at the CPAC conference, where vaccines, we were told, were political instruments of control. They're using it then to take our guns away and our Bibles away. And unfortunately, people believe that. And here's the evidence, Don. Since April, May, 100,000 Americans have lost their lives. 100,000 unvaccinated Americans, despite the fact that safe and effective vaccines were available. These are 100,000 unnecessary deaths, people who believed the disinformation coming from the political right. So this is absolutely devastating, and it's unconscionable for members of the United States Congress, House of Representatives, and senators making these anti-vaccine statements as people are losing their lives on a daily basis, 1,500 deaths a day now.
According to the American Academy of Pediatrics, children now represent more than 1/4 of the weekly U.S. COVID cases. And meanwhile, kids under 12 still aren't vaccinated. They're unable to be vaccinated. How can we keep kids safe?
Well, one of the ways you do that is you vaccinate anyone who's eligible to be vaccinated. So what we're not seeing a lot of pediatric hospitalizations in the Northeast. Why? Because all of the adults and most of the adolescents are vaccinated, and kids are often getting their infection from their unvaccinated parents or unvaccinated adolescents and adults they interact with. So that's the problem. So down here in the South, where we're looking at maybe 25% of the adolescents vaccinated, not much better for young adults. What you're seeing are unprecedented numbers of pediatric hospitalizations. The Centers for Disease Control just reported on last Friday that there's been a 5-fold increase in pediatric hospitalizations over the last month or so. And this is going to continue now that schools are opening. And this is why I don't think this surge is going to end, because unfortunately, the kids are going to get disproportionately infected and get hospitalized and get long COVID. So once again, this is all an unforced error, a self-inflicted wound by coming from people who are pushing the anti-vaccine disinformation.
We appreciate you joining us, Dr. Hotez. Thank you very much. We'll see you soon, and let's hope next time it's better news.
Thank you, Don.